Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here to answer our questions in your marathon hearing schedule here. Mr. Secretary, premiums for working families who purchase their health insurance through the Affordable Care Act marketplaces have, in many cases, doubled, tripled, even quadrupled this year because the administration and Republicans in Congress refused to extend enhanced premium tax credits. With the higher costs, people are literally choosing between rent, groceries, gas, and their health insurance. And please, if you don't know the answer, feel free to say this, but I'm wondering how closely you're watching this. Secretary Kennedy, the tax cut expired in December. Do you know how many Americans have lost their health insurance through the Affordable Care Act marketplace this year?
I know that 87% of the advanced tax credits are still there, so 87% of the people who are on Obamacare are still getting their insurance for under $96 a year. 54% of the
I'm
people
inquiring, do you know how many people have lost their health insurance as a consequence?
Well, it would be the top 13% then.
Okay, the answer is 1.3 million. And I wouldn't expect you to know Wisconsin figures, but it's 22,000 in the state of Wisconsin. And another 2 million were forced to buy plans with higher deductibles to stay insured, which may cost them more money in out-of-pocket costs in the long run. Do you know what percentage of individuals were unable to pay their health insurance premiums on the Affordable Care Act marketplace in the month of January after the enhanced premium tax credits expired?
No, I mean, I know that the Democrats, when they control both houses.
So you don't know. I'll just furnish that information. According to Wall Street Journal reporting, they indicated that about 14% of enrollees, which is a significant increase from past years, lost their or were unable to pay their January health insurance premiums. In some states, it was up to a quarter of all enrollees, a shocking figure. Do you know how much overall enrollment is expected to decline?
No, I know that the last time we looked at it, it was flat, except for the 1.5 million people who were cheating. 1.5 million who were committing fraud. If you deduct that number, the enrollment was flat, but I don't know how it will be in the future.
I'm talking about the Affordable Care Act marketplace participation. Overall enrollment is expected to decline by up to 26%. And this is likely going to be, in part, healthier enrollees who choose not to pay, raising the likelihood that because sicker or unhealthier enrollees will continue to figure out a way to keep their insurance, that there'll be even higher premiums for individuals who need coverage. Your department has also proposed significant changes to the Affordable Care Act plans for 2027, which would increase out-of-pocket costs, introduce more junk insurance, and raise deductibles for working families. The rule also adds millions of hours in red tape paperwork to the enrollment process. Do you know how many Americans your department estimates would lose their health coverage under your proposed rule?
I think it's under the ACA rule.
Yeah.
I can't tell you the exact number.
It's 2 million Americans, Mr. Secretary, and
that's
that would be on top.
That's why it's important to do low premium plans that give people some kind of access to better health insurance at lower costs.
So 2 million that would lose their health insurance due to the rules that you're proposing, and that would be on top of the 15 million Americans projected to lose coverage thanks to the provisions in the Big Ugly Bill and the combination of that with the ending of the enhanced premium tax credits. Now, yesterday in our Labor H subcommittee hearing, Secretary Ken.
Sleep at the wheel. You're over your time.
I will submit these for the, in association with the question that I could not answer, I did want to have a submission for the record. I would ask unanimous consent, and then I will include a reference to those two documents in my question that I submit for the record.
Thank you, Senator.
Thank you.
And I forgot.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.